Hi everyone! So today we're going to present to you guys over bone strength. My name is Brooke Massa.
And I'm Mackenzie Corhorn. So, some of the health risks associated with not having a calcium rich diet include hypocalcemia, osteoporosis, arthritis, and type 1 diabetes.
The first risk that we're going to speak about is hypocalcemia. This is known as calcium deficiency. This is when the blood has too little calcium and when there are lower than average levels of calcium in the liquid part of the blood. Some more symptoms of hypocalcemia include weakness and muscle spasms, laryngeal stridor, which is high-pitched, wheezing sound caused by disrupted airflow, and this may also be called musical breathing obstruction. So symptoms continued. It would be tingling around the mouth or in other extremities, such as your arms and your legs, Trousseau's sign or Chauvat's sign, which is twitching of the facial muscles, fatigue, which is feeling of constant tiredness or weakness, and then dysphagia, which is difficulty swallowing.
Another health risk includes osteoporosis, which means porous bone. If you look to your right, there's an example picture of a healthy bone and an osteoporosis bone, which, as you can see, is more porous. It also includes density and quality of the bone that is reduced, and there is more risk of a fracture. Some symptoms of osteoporosis include fractures in the hips, spine, or wrists, loss of height over time, stooped posture, as you can see to the right in the picture, bones that break more easily, back pain, which is caused by a fractured or collapsed vertebrae. Some more symptoms include lowered sex hormones, which lead to weakened bones, and during menopause, for example, estrogen levels are lowered, so it puts these women at a higher risk. High levels of thyroid hormone, which lead to bone loss, and those who receive gastrointestinal surgery, it then limits the amount of surface area available to absorb nutrients such as calcium.
The next one we're going to speak about is arthritis. So this is inflammation of the joints. And then there's two common types of arthritis, osteoarthritis and rheumatoid arthritis. And this is more common in women and those that are overweight. So some symptoms of arthritis is joint pain, stiffness, swelling, decreased range of motion, redness of skin around the joint. And some more symptoms would be the fact that the symptoms are worsened in the morning time, loss of appetite, which is due to inflammation and immune system's activity causes, fatigue, red blood cell count decreases, slight fever, and joint deformity if mistreated.
The last risk we are going to talk about is type 1 diabetes. This is insulin-dependent diabetes. This is a chronic condition in which the pancreas produces little or no insulin. Calcium and vitamin D supplementation improves disease outcomes in those that are calcium deficient. Some symptoms of type 1 diabetes include increased thirst, frequent urination, extreme hunger, and unintended weight loss. Some more symptoms include irritability and mood changes, fatigue and weakness, blurred vision, and decreased calcium levels, which then increase the symptoms of type 1 diabetes.
So next we're going to talk about long-term risks of not having a calcium-rich diet. So one of the main ones is teeth issues. Cataracts, which is like cloudy or blurry eyesight, shifts in the brain, and then including osteoporosis, which leads to weak bones.
So there are some ways to incorporate calcium into your diet. This includes milk, cheese, eggs, ice cream, cream cheese, green vegetables, fish, and snacks that are calcium-rich nuts. More ways to incorporate calcium into your diet include reducing the intake of caffeine, soft drinks, and alcohol, using calcium fortified foods, which are mostly in breakfast foods such as cereals or beverages. If intolerant to lactose, you can have lactose-free yogurts and cheeses.
So next we're going to talk about some calcium-rich food sources. So dairy is some examples of dairy is cheese, milk, yogurt, and eggs. Fatty fish, some examples are salmon, tuna, and sardines. Leafy greens, such as spinach, kale, collard greens, and okra. And then vegetables such as peas, squash, sweet potatoes, parsley, broccoli, Brussels sprouts, soybean sprouts, and green beans. Some more calcium-rich food sources includes nuts, such as almonds and pistachios, seeds, such as chia seeds, celery seeds, sesame seeds, poppy seeds, and sunflower seeds, fruits, such as kiwi, pineapple, papaya, oranges, berries, and apricots, and then lastly, beans and lentils.
Fortified or enriched calcium food sources include, so fortified means adding nutrients to foods that do not naturally occur in the food. Enriched means nutrients lost during the process or they are then added back in. And some of these sources include breads, grains, and waffles. Some more sources include orange juice, breakfast cereals, or milk alternatives such as soy milk, oat milk, coconut milk, almond milk, cashew milk, macadamia milk, hemp milk, and rice milk.
So next we're going to talk about the importance of vitamin D and calcium. So it helps your body effectively use and absorb calcium. So just to clarify, I'm talking about vitamin D right now. So I'm saying that vitamin D helps your body effectively use and absorb calcium. If not enough calcium absorption is occurring, your body will take calcium from its stores in the skeleton, leading to weakening the existing bone and preventing formation of a new strong bone. So this can be obtained through exposure to the sun, so get outside. This can be found in fatty fish such as salmon, tuna, and swordfish. Small amounts of this are found in beef, mushrooms, egg yolks, and cheese. And it's fortified in orange juice, breakfast cereals, yogurt, and milk alternatives that were discussed in the few slides previous.
Some benefits to having a calcium-rich diet include strong bones, your muscles, heart, and the nerves to function properly, to protect against diseases, and to allow blood to clot normally.
So next, we found a yogurt dip that we thought would be beneficial that some of you guys might hopefully like. So we're going to show you a quick video on how to make this yogurt. We hope that that snack will be very beneficial for you guys. We wanted to find one that had a couple options in it in case some of you guys have different preferred flavors. So we hope that you guys can try that out.
Okay, and now we are on to activity time. So we are going to put 3 food choices out on the screen, and then you'll be able to choose the best calcium-rich choice. For this first one, Out of these three foods, which would be the best calcium-rich choice? And now would be a time to pause the video. The answer is oat milk.
Our next example is the same thing. We have 3 different food items out on the screen. So which one has the most calcium? And now would be a time to pause the presentation, please. And the answer is almonds.
For the last activity, which of these three food items is the most calcium rich? And now would be a time to pause the presentation, please. And the answer is beans and lentils.
Thank you so much for listening. We hope you enjoyed it and learned something from it.